Hi, good morning all. So most of you know the use of KCL in ICU because KCL is one of the common medications. I think it is the most common medications which we use in ICU, right? But do you know? So it carries some side effect. Okay. So here today I am going to tell you why we give KCL the way we give and what can happen if we give in wrong way, right? Well, KCl is a very high osmolar fluid. So that is why it is very important to give it slowly, or if you are giving in high dose, give it through a central line because it might land up with thrombophlebitis. That is, your veins might get damaged and patient will complain of pain. That is why if we give KCl very high dose, in high dose, we prefer central line. Okay. So when KCl solution has to be given, it should be given in which solutions? It should be given a normal saline. Or if cannot give in normal saline, you can give in half NS or you can give in Ringal active, but not in dextrose. Remember, not in dextrose. Okay? You can give in normal saline, you can give in half NS, you can give in Ringal active. First. Second, if you have to give KCl through peripheral line, then how you will give? See, through peripheral line, if you have to give KCl, you give in more solution. That is, make it more diluted, right? So if you are giving in 100 ml solutions of normal saline, in that case, you can add half ampoule of KCl. Okay, 10 MEq in 100 ml. Okay, but if you are giving in 500 ml, then in that case you use in you can give 1.5 ampoule, that is 30 MEq. And if you are giving in 1 liter of normal saline, then you can give up to 60 MEq. Okay, but if you have to give a higher dose, that is the patient is having a severe hypokalemia that is less than 2.5, in that case you have to give a higher dose. In that case you prefer to you give it through a central line, right? Through a central line, you prefer to give it through a central line, and in that case you can give up to 40 MEq per hour of KCl infusion. Okay, and if you give KCl very rapidly, then patient might also land up with severe hypokalemia. In that case, patient might land up with arrhythmia, and sometimes there might be cardiac arrest. So you have to be very cautious. Okay, sometimes we give in EJ, external jugular cannula. In that case, you have to be very cautious because first of all, the vein will be destroyed soon. The EJ might come out, there might be kinking, and it is very uncomfortable for patients. So until unless you cannot avoid giving KCl through external jugular cannula, you try to give it through peripheral cannula with more dilution, or if possible, give a central line. And if you have to give an EJ, then in that case, you can give up to 10 to 20 MEq per hour, right? So do read about it. Go see in the net more about potassium solutions. Also read in book, right? Thank you. Have a nice day.